In this video, we are interviewing Dr. Romero from Hospital de Denia. Dr. Romero, what have been your highlights from ERS 2013?
The ERS Congress is always the best place to know which are the recent data or the last results in research in respiratory medicine. But what I think is very important for me is that the program has a big part of pediatrics. That's different from other kind of congress. So all the pediatricians like me that come to this congress, or all the people that are involved in pediatric care, have different fields of the respiratory diseases related in the program. Of course, the most important disease in children is asthma and allergy, but in this Congress there's not only the focus on it. We have a lot of posters and symposiums talking about asthma, allergy, but also it's very important another kind of diseases in children that are not that common. Is what we call the orphan diseases or the rare diseases, because during the celebration of the Congress, there have been another meetings of working groups where different representatives of European states are represented in, that are working to know a little bit more about these diseases. They have different objectives. For instance, to know consensus about the treatment, about the diagnosis, and another objective is to have a European registry of these rare diseases. For instance, the interstitial lung diseases. And once we have collected all this data, then we can begin some studies prospective to know which is the clinical outcome of these patients, because we don't know much about them. So for me, this conference is not only the best place to know which is the most recent data, it's also the starting point to another further studies in respiratory medicine in pediatrics.
Your article entitled Viruses in Pediatric Pulmonology, A New Perspective is to be published in our respiratory title later this year. Could you give the viewers of Treatment Strategy TV a brief summary of your paper?
Yes, in this article, what we are talking about is the identification of new viruses that have been involved in different respiratory symptoms and diseases in children. In the last 10-15 years, there's been a developing of new techniques of diagnostic. So this has performed a new identification of these viruses. For instance, the human metapneumovirus, the human bocavirus, and other coronavirus. And all these microorganisms are related in different way in the respiratory diseases in children. The most important is the acute processes, for instance, bronchiolitis or pneumonia or low respiratory tract diseases. In this case, the metapneumovirus is now considered as the second leading cause of bronchiolitis, and we didn't know anything about it 10 years ago. Secondly, it's also important its role in the subsequently development of chronic respiratory symptoms, for instance, the recurring wheezing or asthma, and also the metapneumovirus has been related with asthma in the next years of the outcome of these children. And finally, the last papers that have been published talked about the role of the constant replication of the DNA of some virus, for instance, the cytomegalovirus, that can maintain the inflammation statement in the lung tissues. So to sum up, what we are talking about in this paper is that these recently identified viruses have completely changed the microbiological map in the infections in children. So if we can understand better this microorganism, maybe in the future we can have another kind of vacuums and, of course, a more responsible use of the antibiotics.